Heat-related illness. The person with symptoms including headache, nausea, and fatigue after exposure to heat probably is some measure of a heat-related illness. It is important to recognize the difference between the very serious condition known as heat stroke and other heat-related illnesses. Persons experiencing any of these symptoms should consult a doctor. The heat-related illnesses include heat stress. Heat stress occurs when a strain is placed on the body as a result of hot weather. Heat syncope. Sudden dizziness or fainting experienced after exercising in the heat. The skin appears pale and sweaty but is generally moist and cool. The pulse may be weakened, and the heart rate is usually rapid. Body temperature is normal. Heat cramps. Painful muscle spasms in the abdomen, arms, or legs following strenuous activity. The skin is usually moist and cool and the pulse is normal or slightly raised. Body temperature is mostly normal. Heat cramps often are caused by a lack of salt in the body, but salt replacement should not be considered without advice from a physician. Heat exhaustion. A warning that the body is getting too hot. The person may be thirsty, giddy, weak, uncoordinated, nauseous, and sweating profusely. The body temperature is usually normal and the pulse is normal or raised. The skin is cold and clammy. Although heat exhaustion often is caused by the body's loss of water and salt, salt supplements should only be taken with advice from a doctor. Heat exhaustion is the body's response to an excessive loss of water and salt contained in sweat. Those most prone to heat exhaustion include elderly people, people with high blood pressure and people working or exercising in a hot environment. Heat stroke. Heat stroke is a serious condition, and is sometimes fatal, so immediate medical attention is essential when problems first begin. The person with heat stroke has a body temperature above 104 degrees Fahrenheit. Other symptoms may include confusion, combativeness, bizarre behavior, faintness, staggering, strong rapid pulse, dry flushed skin, lack of sweating, possible delirium or coma. Heat stroke occurs when the body becomes unable to control its temperature. The body's temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. Body temperature may rise to 106 degrees F or higher within 10 to 15 minutes. Heat stroke can cause death or permanent disability if